pelvic scan of a 40 years old female with a history of menorrhagia. And what you are seeing is, because of bulging lower abdomen, I can get transabdominally this portion of the uterus in longitudinal section, and what is seen is in this longitudinal section of the uterus transabdominally, that this is the endometrial canal, this is the fundal region, this is the posterior myometrium, this is the anterior myometrium, and the endometrial canal is dilated up to 9.4 millimeters and is filled with fluid. This is the uterus, this area is the uterus, all of this. You can see a thin rim of fluid anterior to the fundal region myometrium, this area. This is the outer capsule. This is a thin rim of fluid around the myometrium, and this now you see that this anterior myometrium is thinned out because of the pressure effect, long-standing pressure effect from this cystic mass in the region of the left adnexal, pressing on the anterior myometrium for a long time. This is the urinary bladder in longitudinal section, and this is a complex cystic mass. We will evaluate it later on. And this is small amount of fluid posterior to this cystic area. Sorry. This is the fluid, and this is the urinary bladder, this area. Now this is a longitudinal section. Moving further, now I am trying to get the transverse section of the uterus. So this is the transverse section of the uterus. Uterus measures in transverse section 4.87 centimeters. This is the endometrial canal, fluid within it, and otherwise. This is the fluid-filled cavity of the endometrial canal in transverse section. And as I move the probe towards the right adnexal, I see a cystic area giving posterior wall acoustic enhancement with debris. This is all debris. This is debris. So debris filled cystic area. This is the uterus in transverse section. This is the cyst, and this is the debris, and this is relatively fluid, clear of the debris. So internal echo within this, no calcification, no solid element is seen within this cystic area in the region of the right adnexal. This is the one in the right adnexal, and its volume is approximately, this is the longitudinal section, this is the transverse section, so you can see that it gives the 345 47 ml of fluid is present in this ecopheril cyst in the region of the right adnexal. Dependent region echoes are more thick. These dependent region echoes are more thick. This is the urinary bladder. This is the urinary bladder. So the volume when after surgical intervention, the volume is going to be more than 400 ml. Now, let's. This was the right. This is the right rather. See the debris within it, and you can see a tiny calcification giving posterior shadow in this view. This is a tiny calcification. So there are a few tiny calcifications as well. Okay, now when I move the probe towards the left side, in the region of the left adnexal there is another thick walled, fluid-filled cystic area with internal calcification. These are tiny calcified areas. These 1, 2, 3, 4. You can see that the echoes and debris or internal echoes are more thick and dense in the left in the left side the cystic area, whereas the one on the right side shows low level echoes more in the dependent region with tiny calcifications. Now why they are cystic is you see the posterior wall enhancement, acoustic enhancement in both sides. Secondly, you see it does not change its shape when I move the probe. This is the cyst on the left side, and this is the cyst on the right adnexal. Left adnexal, right adnexal. And the one in the right adnexal, see the thick wall of this and thin wall of the right side cyst and thick wall of the left side cyst. Now this finding is consistent with either bilateral hemorrhagic ovarian cyst or bilateral pyosalpinx in a 40 years old female. The cyst having a volume of approximately more than 400 cc. The measurement 7.4 by 8.0 centimeter is the measurement of this left-sided cyst. Patient is very tender towards the left side and is not tender on the right side. You can see a row of calcified area in the dependent region apart from these tiny calcified areas. Now when I give a full sweep to the cyst, it does not change its shape. Here I am. See the posterior wall acoustic enhancement. So this is a cyst full of thick echoes with multiple scattered internal calcifications, thick wall, and is consistent with either a hemorrhagic cyst or an abscess or a pyosalpinx on the left side. Now taking both of these together and trying to get you both, if we can get them. Yeah, here we are. Now you see that this is the cyst on the right side, right adnexal, and this is the cyst in the left adnexal. So these are both together, and this is the urinary bladder seen in one view, both left, and this is the right. This is the left, this is the right. One thing to note is that you will see a fluid-filled pocket at the posterior margin of the cystic area on the left in the left adnexal. Tiny septa is also seen. This is the tiny septa. This is the septa, and see this area is more liquefied compared to the anterior compartment of the left-sided thick-walled right adnexal cyst with posterior wall acoustic enhancement and tiny calcification within it. So this is the case of today. Thank you.